Good morning.
Hi, Maurice.
Yes.
How's it going? My name is Dr. Sarah.
Okay, remember I'm 30% deaf, so you
Hard
need
of
to speak
hearing.
up.
Okay. Okay. Can I have you confirm your last name for me before we get started?
It's Kearns with a K,
Perfect. And what is your date of birth?
12/13/54.
Okay, perfect, Mr. Kearns. Well, like I said, my name is Dr. Sarah. I'll be working with you today. And just to confirm, you're here to get a sleep study done, correct?
Yes.
Okay, so what exactly is going on?
This is all covered by my insurance, right?
Absolutely, 100% fee-free, okay?
Thank you.
So what exactly is going on that you need to get this done?
I went for a new job, and they're being real anal. And since I've had a bypass operation, and I'm a Class A driver, even though I'm local, they want to make sure I'm not going to fall asleep behind the wheel.
Okay, and just to get a little bit of history, when was that triple bypass? Do you know the year?
I think it was 2009.
Okay. So this is for a job. Have you had any issues with your sleep? Any like sleep apnea? Do you snore?
None that I know of, and the wife hasn't kicked me out of the bedroom yet, so I guess not.
Okay, perfect. Do you notice at any time during the day you feel out of breath or short of breath with exercise?
Kinda.
Sometimes.
I'm not as young as I used to be.
Okay. Okay. Just a couple more questions to get us started. So, a little bit with movement, which can be normal for your age. Are you noticing that when you're still sitting, resting? Are you out of breath?
No.
Okay, good. Okay, and a couple questions about sleep specifically. Do you sleep on a regular mattress? It's not like a futon or a convertible bed?
No, it's a regular.
What size is the bed?
Queen.
Queen. And just two people in the bed?
Yes.
No pets?
No.
Okay. Would you say your mattress is more firm or more soft?
Firm.
Firm. Okay, and what position do you usually sleep in?
On my side.
Do you know which side specifically?
Depends on whether it's 1 o'clock or 4 o'clock.
Okay,
because
so
I
you
switch
rotate
around.
from side to
Yeah.
side. Okay, good. Okay, and how many hours of sleep do you say you usually get average night?
7.
Okay, so
And
not
if
bad.
I try to get more than that, it doesn't work.
You
so.
can't usually sleep
No.
in. Okay. Do you know what time you normally go to bed? Is it normally around the same time?
Usually around 7.
Okay, so pretty early.
Yeah.
And that has you waking up around 5 o'clock?
Yeah, because I have to get up early for work. So.
Got it. Okay. How many days a week do you get up that early?
All
7?
of them? Yeah.
Okay.
My son teases me even on the days that I'm not going to work. He gets up at 5 o'clock in the morning, and I'm sitting in the living room.
Okay, so early riser.
Yes.
Well, it's good that you have a routine and that you keep it even on your days off. That can help with your sleep schedule. Do you find that you wake up to void? Do you wake up to use the restroom
Yes,
multiple times?
Twice.
Twice.
I do take meds for that, but
To help keep you from waking up?
yeah, to
Okay.
help keep me from having to use the restroom. Yeah.
Do you feel like the medication slows it down a little bit?
Yes.
Okay. So two is a good night for you then.
Yes.
Okay. And say 3-4 hours before bed, are you still drinking fluids or do you kind of cut it off before you know that you're gonna go to sleep?
Nah. Well, I kind of taper it off, but I wouldn't say cut it off.
Okay. So still drinking a little
My
bit.
brat daughter won't let me have enough beer anymore, so.
Oh, she sounds like a good one.
Yeah.
Okay. Okay, and lastly, just a couple questions. Do you take any medication for sleep, like a sleep aid, trazodone, Ambien, anything?
No.
Okay. And you feel like you're doing okay without it? It sounds like you're getting
Yes.
decent sleep.
I don't want to start another habit.
Perfect. Okay, very good. And do you shower at night or in the morning?
Morning.
And my last question is, do you know what temperature your room is when you're sleeping?
Well, my wife, even with the air conditioner on, keeps a fan on, so I would say probably 75.
Okay.
Because the air conditioner says 77, so.
Got it. Do you feel like that's a comfortable temperature for you?
Yes.
Okay. So just scientifically speaking, the ideal sleeping temperature is anywhere from about 63 to 68 degrees, which is about 10 degrees cooler than what it sounds like you have in your room. As we get older, we kind of tend to like the temperature a little bit warmer, but your body tends to be better induced into sleeping, especially into that REM cycle, which we'll get into a little more later, with the temperature being a little cooler. It's just ideally, at the very max, 70 degrees would probably be better.
Do these tests in Alaska or what the hell?
A lot of our patients are actually surprised by how cool it should be when you're sleeping.
Damn that, I'm not a popsicle.
All right, Mr. Kern, so I'm just gonna finish up a couple notes here.
Okay.
I have a little outfit that I want you to put on, a nice little lavender dress, and we have some slippers for you here.
Use the dress word.
Gown, I apologize.
Thank you.
So let me put these bracelets on you. I need you to put on the socks as well.
Good Lord.
Okay. So this is a yellow fall wrist bracelet.
What are you trying to say, man?
For your safety only. Sometimes when we wake up in the morning, we can be a little sleepy, so I do want you to just wear that so we know that you need help going to the bathroom and
Doing
stuff,
that
okay?
commercial, right? I'm falling, but I can't get up.
I also have an allergy band for you. I read in your chart that you're allergic to naproxen.
Yes.
Okay. Is that a severe allergy? Are we talking anaphylaxis? Or?
Yes.
Okay.
Talking 2 weeks in the hospital with
Okay.
2 trees of stuff going into me.
Okay, perfect. Well, we'll definitely keep an eye on that. I'm going to close out my notes. I'll step out and let you change. I'll knock on the door before I come back in, okay?
Cool.
Thank you. All right, Mr. Kearns, you ready for me to come in?
Yes, please.
Perfect, okay, looking very nice. So the first thing I'm gonna start by doing is taking your vital signs, okay? I'm gonna go ahead and get a pair of gloves on.
Good thing my friends can't see me in this outfit.
What do you mean? Purple's your color.
Yeah. My varicose veins colors.
Do you have any quartz, pacemaker, or anything?
No.
Okay, so it's okay to take your blood pressure in your left arm?
Yes.
All right, go ahead and stretch your arm out for me. Carrie, very nice. Is that your wife?
Yeah. Yes, it is.
It's gonna be a little tight, okay? So go ahead and relax your arm here for me.
I have white coat syndrome. Or in this case.
Try not to talk while it's reading your blood pressure, sir. Thank you. We want to get the most accurate reading. Okay, so this should just take a couple seconds. And while that's taking, I'm going to go ahead and listen to your lungs. Just gonna have a look inside your gown. around and listen to your back. Can I have you take a deep breath for me? One more time. Okay. The next 3 times the stethoscope touches you, I want you to say 99.
99, 99, 99.
Very good. Okay. All right, Mr. Kearns, and your blood pressure was 121 over 82, which is about perfect. So, very nice.
Took enough damn pills to get it there.
Yes, I did go over your medication, and it looks like you're on 3 different blood pressure medications. So.
Really? The lisinopril, the metoprolol,
Baby aspirin.
and the baby aspirins. Okay. Those are the ones that put me over the top.
Yeah. Okay. So everything with your blood pressure looks good. The next thing we're gonna do is a very basic exam. I just want to kind of get a baseline of where you are with your overall health, and then we'll get started with the sleep study.
What did you say about my blood pressure? It was good?
Very good. Almost perfect.
So I can tell my daughter I can have a beer now?
We'll talk about it later. How do you feel about red wine?
Buzz is a buzz.
Okay. So let's get started with the preliminary exam. The first thing I'm going to do is get a very, very short test of your overall eyesight. So I'm just going to have a look in your eyes first, okay? So I'm going to have you look straight ahead for me. And it does look like you have 2 different color eyes. One that's tricolor and one that's blue. So that's very interesting.
There's a story about that too.
Yeah.
Yeah, my mom used to say she gave me half a brown eye because I'm only half full of it.
Only half.
Uh-huh.
Have any issues with your ears besides loss of hearing?
No. No.
Okay. Just having a look at your thyroid, not seeing any swelling there. And your eyes did dilate and constrict normally, okay? So what we're gonna do is very quickly go over this book. This is an Ishihara test plate. It's gonna test for color blindness.
Okay.
And any color deficiencies, okay? So just to start, can you tell me what number that is?
8.
And here?
5.
Very good.
29. 74.
Very good.
7. 45.
Good. And the last one we're going to do is this here. Do you see how the line in the middle is a different color
How the line in the middle is a different color.
than
Yes.
the rest of it?
Yes.
Can you
it's
take
green.
your finger and trace that for me?
Okay.
Very good, Maurice. No issues with your color blindness, so that's great. Next thing I'm going to do is check your peripheral vision, okay? So I want you to hold this over one eye.
Okay.
You choose which side. Third eye, that's a good one. So what I'm gonna do is bring my hands into your vision like this. You'll see my fingers wiggling. When you see them come into your vision, I want you to just let me know, okay? Yes?
Long time ago. I can see them all over the place.
Okay.
Okay.
Yes. Go ahead and switch eyes for me.
Got eye boogers on your thing.
Very good. Okay, no issues with that. Thank you. So now what I'm going to do is palpate around your eyes and around the sides of your mastoid. I just want to see if you have any pain. So you're going to feel a light tap. Just tell me, you should feel pressure, not pain, okay? Any pain? No pain behind your
No
ear.
pain.
Okay. Just testing for sinus pressure and any other kind of mandibular or thyroid pressure that you might be having, but it looks
Does
like you're
that echo when you hit me in the head count?
just a little bit.
Oh.
Okay, so the very last thing we're gonna do before we start the test, is I have a couple cotton swabs here. Look exactly the same. I'm gonna touch you on either side of your face and down your neck. I want you to tell me if it feels the same on both sides. Same. Same everywhere, same.
Mm-hmm.
Same as we come down your arms. And same on your legs. No differences? Perfect, okay.
Can I have those? Those might work better than a feather for later.
Sure, just don't stick them inside of your ears, right?
You're gonna touch me with them.
Okay. All right, Mr. Curran, so the last thing I want to do here is measure the circumference of your head. So I'm gonna come around the back.
Stetson.
Does look rather large, but that's okay. What do they say about bigger heads, better knowledge? Looks like we're at 24 inches there. About 25 1/4 at the bottom of the cranium. And lastly, I'm gonna go from front of your hairline to the back, and we're at about 15 1/4, which is normal. Okay.
It would be less, but my hairline is kind of graduated over the years.
Oh, it looks pretty good for your age. Going around your neck. 16 1/2 there. Okay. All right, Mr. Curran, so we're done with that. The last thing I'm going to do here is just kind of explain where we're going before I have you lay down, okay? So I have a couple different things that I'm going to hook you up to. One of them is going to hook up to your finger. That's going to measure your oxygen saturation for the remainder of the night. I have a couple different probes. Just electrodes, they're not going to hurt you. They're a gel pad. They are a little cold, so I do apologize. These will be going all over your face, neck, arms, and 2 on your legs. Several of those. There will be kind of a lot of wires. We'll try to keep you untangled. Everything will be at the top of the bed, so there's nothing electronically that you'll be having to work with. We'll monitor all of that from behind the scenes, okay? Okay. As we have you monitored, I'm sure you noticed that there are several ports inside of this gown. Essentially what it is, it's called a bear hugger. What we're gonna do is hook you up to 2 valves. Looks a little bit like a shop vac, really. It's just gonna keep you at a, remember we talked about that ideal temperature earlier?
Mm-hmm.
So that's where this comes into play. It's gonna help us monitor your body temperature while you sleep, and we're gonna be able to figure out what really is your specific ideal temperature, okay?
My ideal temperature is whatever the wife says it should be.
Okay.
She controls the room.
Sounds good. Happy wife, happy life.
Yeah, all right.
Something like that.
Yeah.
Okay. All right, Mr. Kearns, I'm gonna step out for a second and grab a couple supplies. I just want you to go ahead and lay down and get comfortable, okay?
Cool.
All right, Mr. Kearns, so I'm coming back in. You comfortable? You feeling okay?
Yeah, but good as expected, I guess.
Okay. So I'm gonna go ahead and get you started, okay? We're gonna get you hooked up. I have a couple different things here. I'm gonna start by putting you on 2 liters of oxygen. This is just gonna help ensure we have ideal blood flow and oxygenation while you're sleeping. So I'm just inserting a nasal cannula. I apologize if this is a little uncomfortable. Does that feel okay?
Sure. You don't have any nitrous, do you?
Maybe a little.
All right.
I'll sneak some in there for you.
I got the hookup.
Okay, so I'm gonna bring this over. I'm just gonna rest on top of you. And this is going to help us measure that temperature I was telling you about. So I'm bringing this up and through.
Okay.
And I will connect that to the port. Very good. Okay, I have an oxygen sensor here. This is going to go on your index finger. Okay, very good. And just to ensure that stays in place while you're asleep, I'm going to be applying a little.
Not the finger I was hoping for, but okay.
You can still flip us the bird if you so choose. And this is just a clear bandage that's going to help keep this on a little more securely. Okay, so go ahead and relax your hand for me. Does that feel okay?
Yes.
Perfect. Let me just get rid of this trash. Okay. So as I get you hooked up to the monitors, something will pop up on the screen. It's just a visual for us to be able to see what your vital signs are and how your oxygen is going. It'll help us monitor you while you sleep, okay? So I'm going to go ahead and set that up.
Okay.
It's first going to pop up with the set of your vital signs. After I'm done getting everything hooked up, I'm going to switch it over to a little bit of a darker screen, and that will just monitor your heart rate, okay? I don't want it to be so bright, but it's keeping you awake. So
Okay.
let me go ahead and set that up for you. All right, Mr. Kearns, I have your vital signs pulled up on the screen. Blood pressure is fluctuating a little bit, but it's very similar to what we had earlier. Right now it's reading at about 124 over 83. So very close to what we had. Respirations look healthy, 15, which is good. I have your heart rate estimated at about 81 beats per minute, which is great. So far vital signs look good. Like I said, we'll continue to monitor that while you sleep. If you should need to get up and go to the restroom, I'll have a call light here for you. All you have to do is hit the button. I'll come in and everything you have on is portable. So we'll just take it with us to the bathroom, okay? So currently measuring blood pressure, like I said, oxygen levels, temperature was fine when I took it earlier. I'm gonna go ahead and start setting you up with our electrodes. And I do apologize, these are pretty cold. So I'm gonna start with one here. Coming up to your head, I'm gonna place a few here on your temples. This one's a little uncomfortable. I have one that's going right in between your eyebrows. The last two I have are going to go down on your legs. the wires. And as you're resting, I'm going to go ahead and switch over to just your heart rate so the screen's a little darker for you. Give me 1 second. All right, Mr. Carnes, I now have just your heart rate up on the screen. It should be a little darker for you, hopefully less distracting. And this screen will remain up throughout the remainder of our session. I'm going to go ahead and connect your temple probes. A little bit of pressure, I apologize. Okay, Mr. Kearns, before I let you go to sleep, I'm just going to ask you a series of questions that I'm going to repeat in the morning when you wake up, okay?
Wonderful.
Can you tell me what high school you went to?
El Monte.
What city was it in?
South El Monte.
Do you remember the name of your first pet?
My first pet?
Yes. First one you remember.
Little bit.
What's your favorite number?
13.
Okay, and I'm just going to give you 3 words, and we'll have you repeat these words if you can in the morning, okay? So the first word is alligator. Second word is Simon, like the name Simon. Third word, telephone. I'm going to give you a series of 3 numbers. 57, 25, 133. All right, Mr. Carnes, that's going to conclude this portion of the exam. I'm going to get you monitored from the other room, so I'll step out, let you rest. We will be coming to check in on you periodically. You have your call light here should you need anything. You're gonna hit the big red button with the nurse picture on it, okay? Other than that, I'll see you in the morning. Thank you so much.
Good night.